on distance education and e-learning. Today's e-seminar, 5 ways how to use e-learning in laboratory medicine effectively, will be presented by Dr. Daniel Rajdl from Institute of Clinical Biochemistry and Hematology, Charles University, Medical Faculty in Pilsen. His main research topics are risk factors of atherosclerosis and the markers of organ damage, especially kidney and the myocardial. He also has a lot practice in teaching, face-to-face teaching of clinical biochemistry, and has a lot experience in e-learning, preparing e-course with e-book, interactive quizzes, and voiceover presentation. Now he's a chair of working group on distance education and e-learning under Committee Education and Training in EFLM. So I think there is many reasons why he's probably the best person to present us possibilities of e-learning today. I would like to show you a few technical options how to use your interface today. If you would have any questions, please do not hesitate to ask him whatever you want and whatever, or add some of your comments using this question and as answer option on the right side of your screen. So please, Dr. Rajdl, the microphone is yours.
Dragana, thank you very much for your introduction. I would like to start with this graph which shows my today's physical, emotional and intellectual properties. It is not very good today for me, so I hope you will help me with this webinar. It's quite a big issue for me, big challenge, and I hope we will go through the webinar quite nicely. The worst thing on webinars is that I cannot see anybody of you. Maybe now you can see me, but I have no idea whether you hear me, whether you react to my speech or not. So please, if you have any emotion, any opinion, write it into the chat, or it is much better for me to react by choosing the emoticons or the moods from the top menu of your environment. So if you agree, if you disagree, or if you don't understand, try to communicate with me by these emoticons. That's much better for me because I can see your reactions quite easily. People are coming still, but we will start with our program. First, I should also introduce our EFLM working group, Distant Education and E-Learning. There are several members of it. Dragana was the previous chair of this working group. Then we have here the young scientist Ada Aita. Then we have Sanda Jelisavac-Osic. Maybe Anna Merino, I am not sure. If you are here, please write into the chat that you are here. Enrique also should come. So this is our working group that prepares the webinars or e-seminars for you and will do it for the next period too. What will we talk about today, or what are our goals for today, our objectives? First, we should talk about e-learning generally, why and when we should or we can use effectively e-learning, and then we will talk in some extent or to some extent about 5 ways to e-learning success, or 5 ways how to perform e-learning. The majority of time we will talk about webinar, voice-over presentation and quizzes, then a short note about user-generated content, and ebook will be in the end. Also, throughout the presentation, I will try to give some examples from our practice and some hints for you. Not sure whether it will be useful for you, these hints. First, we should have the question. That's a reminder for me not to forget the question. I would forget the question. So the first question here is, what tools do you use nowadays when you teach your students or when you consume some e-learning. Okay, so please vote. Maybe I will show you the results. The majority uses webinars. Maybe today they use the webinar, and sometimes voice-over presentations. Quizzes also are quite popular. Okay, not everybody was voting, so try to cooperate with me more quickly. It is nice when I can hear that you are here. And the first hint for presentation is that you should tell the audience what you are going to tell them. Then you should tell it, and after it you should tell them what you have told them. So I told you what I am going to tell you, and now I am going to do this. What are the basic e-learning scenarios? To have the basic overview how we can use the e-learning. Either we have the distance learning, the pure distance learning, or we can combine it with face-to-face learning, which is called blended learning. This is the most common way how we use e-learning in our setting, so maybe sometimes I will emphasize this way, because this compensates the disadvantages of both ways of learning or teaching. Also, during the e-communication or e-learning, the communication or the interaction, teacher-student interaction is very important. Sometimes some courses can live without teachers. They can be just produced and then no teachers are needed, but it is recommended that there should be a live teacher. The ways of communication are either synchronous, in real time, like we here are communicating in real time during the webinar or during chat. This way of communication is good for motivation, for understanding, and for increased arousal. Not sure whether you are engaged, aroused today, but theoretically it should be better than the second way of communication. This is asynchronous. This is the classical way of communication, like email or discussion forums, surveys, and so on. This is much better for the individual pacing because the student can learn in the pace that is good for him or her, and also for reflection and data processing. So this is basic overview about the e-learning. What is the evidence based about the effectivity of e-learning? There are some studies that say that e-learning is better than nothing. Yeah, this is sometimes it seems that it is not enough, but if you have no other possibility, e-learning can be a very good option for it due to capacity reasons and so on. Some studies say that e-learning is more effective, for example 11% more effective, or the same objectives can be achieved with e-learning in shorter time. What is the main problem with these studies? They usually do not look on the goal, on the patient outcome, and it is not clear what was the methodology, what was the goal of the teaching. So this quite nicely demonstrates this recent meta-analysis, or the try to perform a meta-analysis of effectivity of e-learning. Here they say that there is a big methodological variation, so they weren't able to do the proper meta-analysis, but they suggest that e-learning was at least effective as traditional learning approaches and superior to no instruction at all. There is no data on effectiveness of e-learning programs on patient outcomes. So this is a bit inconclusive, these conclusions, but the main limit is that there is no universal definition of effective e-learning. We are in the situation like we were before the universal definition of myocardial infarction. There is no standard algorithm, no standard evaluation criteria to e-learning effectivity. And the basic thing is that we have a very wide range of goals in e-learning. Different goals will be when somebody will use e-learning for blended learning for medical students, and different it will be when we will use it purely distantly for continuous postgraduate education. So what is recommended today is to give emphasis to whether students and teacher enjoy the e-learning, and not so much to whether students have better performance in quizzes. What is the hint from these theoretical backgrounds? If you want to start e-learning, start it now and a bit intuitively. After you start the e-learning, ask your audience. Try to ask them for feedback. I also will give some guidance to intuitive starting of the e-learning program. One of our experience is that we have made a short feedback for our students where they simply marked what e-learning material do they like best. And it was quite surprising for us, because before we thought that the voice-over presentations, the presentations that make a lot of effort to produce them, are the best, the top e-learning material, but our students said that for them the quizzes that we made for them are the best one. So sometimes it is a surprise. We suppose something that it will be the best thing for students, but they can think something else. So feedback is the basic thing. How to construct a basic feedback? First, you should write questions. They should be as simple as possible, as short as possible, and you should be able to imagine how you will interpret the answers. You should also make basic validation of the feedback questionnaire. One expert should be from your discipline, the expert on your discipline, and one expert should be an expert on question construction. Then also the last very important thing is to listen, to be open to these suggestions from your students. Tools that can be used for making feedback, the electronic tools in e-learning. Google Forms, there are links here. They should be active, so if you want, you can click on them and open it. If you know Google Forms, you know what they can look like. They are very convenient. The results can be displayed very clearly and very easily. So I recommend the Google Forms. More complicated possibilities and more thorough possibilities offer environments like SurveyMonkey or some learning management systems. Also, the so-called big data that is produced from learning management systems, from social media, can be helpful in feedback. I will talk about this later. Here are the examples of big data. For example, the website analytics can help you to compare two time periods before and after starting the e-learning, whether the visits increased or not, and what was the material the students or the visitors were interested in. More detailed analysis of visitors and of results are in e-learning courses. In the e-learning courses analytics, there are not only views, but you also can analyze whether the student went through the quiz or some questions, some control questions successfully or not, and so on. So e-learning courses analytics is more detailed or more concentrated on your needs. Also, quiz analytics is inside the course analytics, and we will talk about this in quizzes section. Social media analytics is a big topic, and it is very nice. For example, here you have two links. The first one is for Facebook Insights, which can show you can see it here, what were the visits during the days during the week. And also during the day. They will show you when your audience is most awake or most prepared for posting your message. And this is very important in social media, because social media is very fluidic, and if you are not at the right time, if you do not post the message at the right time, it needn't to be so effective. So this is big data examples that can help you with feedback about e-learning. One thing that I like is learning from your failures, and I like this organization or happening. The fuck-up nights that are organized throughout Europe, and some businessmen usually are talking about what they did erroneously, what was wrong, and how it influenced their further life or further professional development. So one hint for you, for me, for everybody, is to be frank to yourself and listen to the feedback. If somebody says you that the e-learning material is wrong, don't think that it is right, because you have some theoretical background about this. One thing that we always should decide before we start doing learning materials is that the new material should have some added value. It should have some sense. One thing that is nice on e-learning is that it can intensify the educational process. You can have a great capacity, you can have more students, you can process more information. Also, it is very good for the so-called flipped classroom, where students learn information at home, through the e-learning materials, and understand or try to understand the problems during the face-to-face education. Also, the added value of e-learning is quantification of effectivity, the measurement of quality of education. This can be derived from feedback questionnaires and big data. It is much easier to draw this data, much easier than in face-to-face learning or face-to-face teaching. Also, e-learning can serve for standardization and harmonization of education, because we can share the materials and we can set rules for e-learning quality control. And also we can demonstrate by sharing the question banks or e-learning courses the best practices how to do something. So this is a good way how to standardize or harmonize education. Okay, so now we can start the thinking about how to create an effective e-learning. I like this quotation from Norman Wisdom. He said, as you get older, 3 things happen. The first is your memory goes, and I can't remember the other 2. That's really true. If you have children, you can observe that your children, or at least my children, have much better memory than me. And I think that my ability to learn from associations, for examples, from case files, for clinical problems, is better than when I was younger. So we are not set up for memorizing, but for learning from associations. So the best way how to start creating e-learning program is to have a clinical situation, clinical problem. From this to derive questions, and in the end to make the content, the e-learning content. So it is a bit vice versa. It is not a good idea to start with seeking for literature and then trying to write some text, and then from this text derive the questions and so on. It should be vice versa. First there should be a problem, then questions, and in the end the content. The clinical situation can be defined like a problem or case file, and you should define objectives, what you want to learn or what you want to teach. Questions are the best feedback for students. It needn't to be just for assessment. It can be also a learning material just for students to have good feedback and good learning material. And content should be always linked to the questions, and this content can be text, presentation, and so on. Here is an example called Sleepy Cook, which is the objectives, the clinical example. We have here a 57-year-old woman with chest pain and dyspnea. She is somnolent and she has some history of taking a lot of antidepressant drugs and some analgesic therapy. So the basic objectives are chest pain, differential diagnosis, dyspnea maybe, and maybe somnolency. From this, we should derive some questions about chest pain and about myocardial infarction. So the question will be whether the patient has myocardial infarction, yes or no. If the patient has 11 nanograms per liter and the cutoff value for this hypersensitive troponin T is 14 nanograms per liter, so you can answer through chat or through the emoticons if you want, whether we can exclude the myocardial infarction in this woman. And after this question, we should derive the content from these values, and the content is the new recommendation for a new algorithm for acute myocardial infarction diagnosis. So this was just short demonstration how making the e-learning materials should be performed. Okay, here we have a small test for you. Please try to answer what is more similar. If you compare the shapes here on left and the shapes here on right, what do you think? The A or B is more similar to the shape on left? The upper or the lower one? Okay, here are the results. So majority was clicking on the A and not so much for B, and I think this is a good thing for you, because A is that you can look on problems globally, you are happy and you have better diagnostic approach, and you are able to solve problems creatively. And B is that today is not your best day, you are concentrating on details and you are a bit unhappy. So this is very stupid, or this is one of the psychological quizzes or tests. It just reminds us that emotions during the clinical examples and during the education are important. So use emotions even in your e-learning materials. Let's start with presentation, with several tips or several hints about presentation. How to present the clinical situation. Presentation, according to the definition for kids, is an act of showing, describing, or explaining something to a group of people. Maybe I am now presenting something. Either we have, according to the way of delivery of the presentation, we have the face-to-face or online live presentation like this, or voice-over presentation, which can be played on demand. They have some common rules, but there are some differences between the e-learning and the face-to-face setting. Here are three basic rules for a good presentation. I just selected three ones that I like. The first one is be short. I like this rule, but I usually am not able to fulfill this rule. So maybe today we will be okay with this one. It is proved that human mind is set up to maximum of 7 things at once, at one time. So the best way how to present something is to give just 3 ways or 3 key points into one slide or in one presentation entity. The second one is that you should ensure that students understand you by polling, by quizzes, by some discussion, which is very good because it's not always clear whether students understand you, even if you think they understood you. If you could click on the link here, the Poll Everywhere link, and try to answer the question that is there. This is an example of online application. Also, you can be inspired from topics from other disciplines. This can help you to make your thoughts more vivid and with more concentration of important things, not to be too much concentrated on details. Okay, what's special with e-learning? E-learning is a bit different or e-learning presentation is a bit different from the normal presentation because today's student, especially in e-learning, is devoted to micro-learning, so very short pieces of information because it's overloaded. Hope you are not overloaded, but it is said that 41% of time we spend on activities that don't lead to completion of given tasks, and that is why we are overloaded. We are doing things not effectively. We have lack of concentration. Generally, our young colleagues, maybe even we are distracted each 5 minutes. Generally, they check smartphone 9 times per hour, and they are online on average 27 times daily. Study here says that it is from 5 to 10 seconds. So our student is very impatient, and if you cannot draw attention from the beginning, they are clicking anywhere else, or they are closing the window of the webinar. So that's a bit special in e-learning. Study here says that it is from 5 to 10 seconds. So our student is very impatient, and if you cannot draw attention from the beginning, they are clicking anywhere else, or they are closing the window of the webinar. So that's a bit special in e-learning. So that is why the micro-learning can be used. It is spontaneously used in YouTube videos. The videos should be short, quick, and very straightforward. Best is if it is less than 2 minutes, and if this is optimized for the mobile use. It is much easier for development. Everybody can create it without special training, and it is suitable for clarification, simple concepts, basic overview, but it is not so suitable for a more deeper insight into some more complicated problems. What tools can I recommend you for creating voice-over presentations or these short micro learning presentations? Microsoft Office, LibreOffice, OpenOffice, it is possible to do it with these tools, but not very convenient. A much better possibility is Office Mix. You can install it freely. It's from Microsoft, and you can see that it is integrated. Here you can see that it is integrated into the Microsoft PowerPoint. A new ribbon is here if you install this add-in, this software. And it enables you to make voice-over presentations, screen recordings. You can make electronic ink to record the presentation very, very easily, and you can also insert some interactivity like quizzes, for example. It is a very nice tool, and I would recommend it for you if you want to start e-learning today. There are a lot of other tools. For example, Screen-O-Matic can be a choice for you for short presentations. It's free, and it can fulfill your needs. Also, Adobe Presenter as an alternative, but commercially available alternative to Office Mix. It has some more features over the Office Mix, but not too much. And there are other like Adobe Captivate and others and others. So basically, if you want to start and you have Microsoft Office, use Office Mix. Here we have the question, what tools need PowerPoint for installation or for functioning? Results. Also, I didn't mention it too much, but also Adobe Presenter is integrated into Microsoft PowerPoint, so you need PowerPoint for it. So these were tools for creating voice-over presentations. There are some hints for you. For longer presentations, if you do not want to have these just short presentations, these 2-minute presentations, micro presentations, the table of content is very useful. Not all software can do it, but Mix or Adobe Presenter can do it for you. Slide notes can be a good source for narration, because it's quite demanding to not say the and so on during your recordings, and in a recording it can be harmful to have a lot of these sounds, so slide notes are good for it. Of course, there should be some balance of counteracting influences. For example, if you want to have best compatibility, you cannot have best user interface and learning potential, because best compatibility means video, and there is no interaction or no good interaction in video. You need some other formats, interactive formats for interactive user interface. For example, quizzes cannot be inserted into video, or very hardly can be very hardly inserted. Also, you can hesitate between condensed and narrative style of presentation, the micro-learning and broad learning or narrative learning, informal and formal, professional-looking presentation or video. For example, it is quite clear that if you use more informal, not so nice video, but that clearly the problem, the topic, it is much better than to have a professionally looking formal video. So don't be afraid of doing videos, just your smartphone is good for it. A short note about microphones, because they are very important for you when you want to make voice-over presentations or when you want to perform a webinar. Built-in microphones can be used, they are usable, but not optimal. The best one for webinars are headsets. If you want to discuss with somebody, it's best to use a headset. If you want to record, if you want to do the voice-over presentations, the desktop microphones are the best one. Also, if I could recommend you, use the USB microphones, because they have inside the small sound card, and the output of the sound is more standard, not so dependent on the hardware you are equipped with. Okay, so we go to webinars. We should shortly talk about why webinars are good to perform. Of course, we can save time because we need not to travel. We can decide whether this webinar is good for us or not. Just close the window, and we can use the webinar repeatedly because it can be recorded. Also, it is more accessible. Also, people with low-income countries who don't have money for education can be on webinars, and also some physical barriers can be overcome through webinars. Sometimes it is said that engagement can be higher during webinars than in face-to-face meetings, but I'm not convinced that this is true. But we have tools here, like the polls and so on, that we can use for it. Why not to use webinars? Because the personal contact is quite limited, and there are some technical issues. You can see that the chat is full of of some technical issues, so not everybody was able to be here and to listen to this webinar. Also, distraction of attendees can be a bit more oftenly present because you have a lot of things around you and not just the room where the presenter is. Basic webinar scenarios are quite clear. Today we have this classical scenario that there is one presenter and several attendees. We can make hybrid webinars too, when the presenter is speaking to a live face-to-face attendees, and also some online attendees can be also there. And of course, webinars or the meetings can be used for discussion meetings. Features of webinar software are very wide. The basic one is to transfer or transmit voice, video, chat and presentation. You can see everything here. There are some advanced things like screen sharing, mobile device support. This is a very important thing, I think, for you. It is very convenient to consume webinars on a tablet or a smartphone. Try it. Also, some things that are behind the scene, the back office, are quite good for presenters. For example, I have here a visual representation of your engagement, and now I can see that your engagement is about 67%, so probably I should do something more active for you to be more engaged now. That's the back office that can help you with making the webinars. Here you can see the user interface on a tablet, how you can annotate the presentation and even present the presentation through tablet. What service to use, what software to use, it is a difficult question. There are a lot of environments. If I talk about these free services like Big Blue Button or Open Meetings, this can be achieved if you have a good IT support. Also, these two alternatives, Hangout and Skype, are quite good. And of course, there are some commercial softwares. If you hesitate or if you want to decide, Google Fight is not a bad address. So try googlefight.com. This is a very easy way how to decide, even if you want to change your partner. What is my advice for using webinars? What are the academic resources? What are the free services that you can use? First, you can ask your IT department and search academic resources in your university or in your country. Maybe you will be successful. In our country, it is possible, and we can find some software that is offered by our universities or academic societies. If you are not so lucky, you can use Skype, but it has some limitations. The free version has some limitation that you can see here, that just 10 people can lively stream the picture, and 25 users can be there at one time. If you want to perform something bigger, Hangouts on air can be your choice, because it is connected with YouTube, and 10 people can broadcast, and there is no limit for viewers, so unlimited number of viewers can see you during the webinar. Not so convenient as, for example, this environment, but very easily usable, and it's free. The mentioned Big Blue Button is only for special things, if you have the great IT support who will install it and who will do it for you. And also there are some commercial services, not so important today to talk about this. The basic webinar workflow looks like this, that there should be some invitation, registration, reminder. Majority of you received a reminder yesterday, and some support, technical support before webinar. Usually 2 people can manage this. If webinar starts, there should be a phase of socialization. It's a very difficult phase. I'm not sure whether today we were successful in it. and the presenter should be there 5 minutes before start, moderator and IT support, and also fans or the psychological support for the presenter can be there. In the end, the feedback is very good to have. Usually 3 people are necessary for performing a bigger webinar: presenter, who presents, the moderator, who moderates and governs the discussion, and some kind of IT support. The fans are here for making atmosphere and giving positive or negative feedback. What is the basic workflow of recording or voice-over presentation processing? Because if we record this meeting, this webinar, or if we want to have a voice-over presentation from this, we have to process it a bit. The basic thing is that you can capture your own presentation. For example, if you use Office Mix, you capture just your own presentation, and you can export it to a video, and video can be uploaded to YouTube or Vimeo or other streaming services. If you want to add interactivity, you have to choose another export format like HTML5 and other formats, and this can be uploaded to your LMS, to Moodle, or some things like Mix LMS. For example, you can click on this picture here, and this is an example of one of our last webinars that is made through the Adobe Captivate. Okay, so this is the basic workflow. There are other options here that are quite complicated for today. I think I won't talk about this today. To have time for other things that I would like to mention, and these are questions, the quizzes. We have talked that these quizzes should be related to the clinical situation. There are 2 very nice types of questions that I like. This is single best answer question connected with the clinical case, and the extended match question, which we will demonstrate on slides that will follow. First, you have to have some goal of your quiz. So you should blueprint the quiz, review again, and let students to have some attempts, and then perform the quiz analysis. From the quiz analysis, you should modify your quiz again and again. So this is the circle of how to make the proper quiz. From this good question checklist, which is much more for reference if you want to go back to the recording, not for going through it completely, I will select this point that quizzes should test application of knowledge, not only evocation of isolated facts. Let's demonstrate some of the questions. You have one question here about the patient who has progressive metabolic acidosis, and these laboratory results. You can try to answer the question: low pH, negative base excess, and a bit high osmolality. So if you think about the possibilities, just one is the single best answer, and because of high osmolality, and all other things are excluded, like diabetic coma, because there is normal glucose, or the renal failure, there is not so high creatinine and so on. So methanol or ethylene glycol should be the right answer. So you can go further. And here is the enhanced matching question, or extended matching question, which has the same setting, a short introduction about the patient, but you just try to match several things to explain, for example, why corrected chlorides are here decreased. So here it is because of vomiting, sodium is decreased because of osmotic effect of glucose, and so on. So this should demonstrate the quite strong ways how to go through more complicated questions. I hope you have tried it and you have understood what is the power of these questions. What are the tools for question creation and management? There can have some, or they should have some features that the types of questions that are offered by this environment, or how the question bank can be managed, and what can be the blueprinting and review process. From tools that I would recommend, and we have good experience with it, is Moodle. We use Moodle for e-learning courses and for student assessment. Also, we use Socrative for in-class testing what students know, and after we know what they know, we can make a bit different presentation or different setting of the presentation during the face-to-face learning. With analytics, here we just mentioned the discrimination index. The learning management system can give you a good big data example or big data evaluation. One of it is discrimination index, which says you how much is the question able to discriminate good and bad students. If there is one question that is always wrongly answered by good students, there is something wrong. Probably there is something wrong with the question, and vice versa. The interpretation of the discrimination index is like this, and we can go from quizzes to other topic. The Wiki or user-generated content is very short. Just that the basic advantage of Wiki is that the more authors can write simultaneously one material. There are no version conflicts, and you need not to send again and again documents via emails. There are a lot of services, software to use for Wiki, like Wiki Spaces or Google Docs, and they also have the real-time writing, so there is no chance to have a version conflict. You can generate books, documentation, or quality management system documentation by Wiki, because there is a good track of changes. From this, you can derive, or it can also help us the Wiki generation of some common space where the knowledge is concentrated. We can derive also the just-in-place learning or augmented reality trend in education. These e-learning materials can be connected with place where a student is. The system can recognize where you are and offers contextual learning material. Either they use GPS. This is not so convenient today because indoors GPS doesn't work very well. But QR codes are very easy to use. For example, the QR for Office application for your Microsoft Office application can be a good way of using QR codes. And here can be an example how to use QR codes. You can stick the QR code on a machine. One can be connected with a web page where with Wiki, for example, where the short voice-over presentation about this part of a machine is, and also some, for example, urinary sediment atlas can be on another link or another QR code. Last thing about making e-learning courses and e-learning materials is about ebook. We have some workflows for it. We have done several ebooks. Just to mention the basic workflow, we use Word and freely available Sigil as a good program for producing EPUB format for ebooks, and this can be converted by Calibre to many other formats that are available here. For example, for Kindle readers and so on. So here is just a motivational slide about why the e-learning should be near to laboratory medicine, why we should be the best one teachers in e-learning. One reason is because we are familiar with computers, IT and information systems. Also, some methods in laboratory medicine and electronic learning are very similar, especially regarding the harmonization, verification, validation. This is very similar in laboratory medicine and in e-learning, so it can be similar. Also, we are dealing with virtual things, glucose and other analytes. Almost nobody of us have seen it, so it is virtual, and the e-learning is also a bit virtual in this setting. I also think that teaching is an essential part of our profession, because we have to communicate with our colleagues from laboratory medicine or other professions. We have to explain new biomarkers usage and so on, and also we should communicate with patients. So good presentation and good materials, e-learning materials, can be helpful in our professions. One of the last slides in my presentation, so these 3 causes for e-learning program failure are that there is a low quality of study materials. We should have a quality control system, because e-learning materials are easily edited. There is no cost, the so-called no cost, so there is a tendency not to deal too much with the quality of e-learning materials. The second reason that I can see here is that we don't dedicate a special time to e-learning. We just add e-learning courses, e-learning material to the normal workflow or normal studying, and it is not possible to study 24 hours a day. So secure a time for e-learning if you want to use it properly. Also, in e-learning environment, the engagement is much lower than in the face-to-face learning. If you have possibility, try to engage your audience much more than in normal settings. E-FLM and e-learning, you can see that this is very connected, not only because the name of the E-FLM, but also because we are trying to develop some things in e-learning. The core activity of our E-FLM workgroup are these webinars. Not all the webinars will be so off-topic as today's webinar. They will be about things like rational use of laboratory tests. This is the next webinar, and other webinars you can see here that they will be about laboratory medicine much more than this one, than today's webinar. And you always have possibility to follow the webinar, the recording of webinar on our E-FLM YouTube channel. So if you do not know this, try to click on the link and try to subscribe to our channel. We have also a Twitter account, and I dream that in the next few months, years, we could be able to have a question bank where we will have some questions like I demonstrated previously, with short case file and some extended matching questions or single best answer questions. I think this will be a good opportunity to harmonize education in Europe and to share our expertise throughout Europe. So this is what I was talking about e-learning and the reasons why to use it. We have said that there should be first a clinical problem. From this we should derive questions, and from questions we should derive the content. The presentation should be short. You should always be quite sure that people understood you, so you should check it by asking your audience. And we have talked about webinar, voiceover presentations and quizzes in some details. Not everything could be covered, but I think something can be useful for you. I think now there is time for discussion. So if we have some questions. Okay, and maybe before some questions appear here, we have some here. One question was here from the registration form from Bernard Gouget. He asked about whether we are planning to organize webinars in different languages like Spanish and French. The answer is quite easy. Not today, not yet. It makes for me no sense why EFLM should organize this, but we can give support for your local tries to do something. So if you have some questions about how to do something, we are here, but we do not intend to do some webinars in local languages.
Well, here Dragana is talking again. Thank you, Dr. Rajdl, for this very interesting and very comprehensive webinar. You present us a lot of new things, maybe for you basic, but for most of us new information about e-learning. I think I can say that many of our colleagues are not familiar with these all possibilities of e-learning programs. So if, dear participants, if you have any questions, please do not hesitate to put them in this question and answer window on your screen.
Then we have here the question from Dan. How can we use effectively emotions in e-learning? Hard question. I tried to demonstrate that if you try to engage participants by some stories that are a bit emotional about real patients, usually real patients are connected with some emotions, this can set up the framework for thinking, and this can make arousal for the students to better receive the information from the e-learning. So, for example, clinical cases can be emotions used in e-learning.
So maybe until we are waiting questions for you, Daniel, maybe you can answer me. You mentioned a question bank as a possible activity of EFLM that can support education and harmonization of it across Europe. So do you think that people will be willing to share their knowledge and time to give questions?
I hope. I dream about it. We can ask this audience whether some of you will be available for sharing these questions. Personally, me and our group of e-learning creators is available for sharing the questions, and we will try to start this activity. But nobody here is answering, so I'm not sure whether this will be just a one-sided activity. Then it has no sense, because the principle is to share the knowledge and to harmonize the information. So we will see. I think the principle that I said in the beginning, to start intuitively and then to wait for or to ask for feedback, will be valid also for this case. So we can start with something and try to ask whether this was successful or not. Facilitate online questions. Okay, best platform. This is always difficult. One thing is what is available for you, and what is then best. Best can be defined only if you have some goal. But generally, I would recommend the Moodle if you have possibility to use Moodle, and you have the possibility to use Moodle, because you can start a course on Moodle, free Moodle services that the Moodle company is offering. So the platform for online quizzing, good for online quizzing is Moodle, according to me. Also, when you want to use the polling and simple questions during your face-to-face meetings, the poll everywhere, which I mentioned during the presentation, is a very good option, because it can be integrated into PowerPoint and easily used by the devices that students are owning, their own devices. And maybe the last example will be the Socrative software, which is also free of use, or this is exactly free of use. The poll everywhere is not free for all the types of usage. There's some limited use. So the Socrative can be also a good choice for immediate feedback. It has good user interface for a teacher, that you can see very clearly and very early the results of a big group of your students. There are some other questions here. Some philosophical question from Dan. Do you think that e-learning is the future of education, or the traditional way is still the best? This is really a philosophical question, because I think both forms are useful in some situations. The best way is face-to-face learning, but e-learning can help you with intensification of this education process. For example, if you have face-to-face teaching with students who doesn't know anything about your topic, about your problem, then the face-to-face teaching is not very effective, and that is why e-learning can be helpful. But just to say that e-learning will be the future of education and no face-to-face learning will be there, I don't think so. The gurus and the teachers, the alive teachers, are a much better way of transferring information, but e-learning can help you with this. When will be the database of questions available from Toshe Besta? Approximately, don't know. This is just proposal. This is just dream, as I try to explain. We will try to offer this way of sharing e-learning materials, and according to the feedback and to the involvement of other subjects, we will see what will go on. So there is no deadline for it. We will try to do it this year. It is planned for this year. Okay, so I think the questions are maybe over. If you have no other questions, so I will ask you to fill in the feedback, because this is the last step in webinar. So if you will be so nice and fill this short feedback, it will be good for us for our next webinars.